Welcome to Burnaid channel. Thank you for joining us. Today, we'll discuss a comprehensive nursing care plan for patients at risk of bleeding, including assessment, interventions, and evaluation strategies. Nursing diagnosis, risk of bleeding. Risk of bleeding is associated with factors that could disrupt blood clotting processes, such as medication effects, surgical interventions, clotting disorders, trauma, or underlying medical conditions. Desired outcomes. 1. The patient will exhibit stable vital signs and adequate hemoglobin levels within normal ranges for age and gender, indicating effective management of bleeding risk. 2. The patient will avoid bleeding episodes, demonstrating successful implementation of preventive measures. 3. The patient and family will demonstrate understanding of and adherence to precautions to prevent bleeding, showcasing knowledge and commitment to self-care. Nursing interventions and rationales. 1. Monitor and document the patient's coagulation profile, PT, INR, APTT, and platelet count as ordered by the physician, using a standardized template. Rationale, laboratory values guide treatment decisions, indicate effectiveness of therapies to control clotting, and enable timely adjustments. 2. Administer prescribed anticoagulants and monitor for signs of bleeding, such as petechiae, ecchymosis, hematuria, tarry stools, and changes in mental status. Rationale, anticoagulants can increase bleeding risk. Close monitoring allows for early detection. Nursing interventions and rationales. Intervention, and prevention of complications. 3. Educate the patient and family about recognizing signs of bleeding, measures to take if bleeding occurs, and importance of adherence to treatment plans. Rationale, knowledge empowers patients and families to act swiftly, making informed decisions, and seeking prompt medical attention when necessary. 4. Implement fall precautions and safety measures to prevent injuries that could lead to bleeding, using a multidisciplinary approach. Rationale, preventive strategies reduce the risk of trauma and subsequent bleeding in. Nursing interventions and rationales. Vulnerable patients, promoting a safe environment. 5. Avoid invasive procedures when possible. Use minimal tourniquet time during blood draws, and apply pressure for adequate time after needle removal. Rationale, reducing invasive techniques lowers the potential for vascular disruption and bleeding, minimizing risk. Evaluation. 1. The patient will remain free from signs of bleeding throughout the care period, demonstrating effective management of bleeding risk. 2. The patient's laboratory values will stay within targeted therapeutic ranges, indicating successful control of clotting processes. 3. The patient and family will verbalize understanding of bleeding risks and preventive actions, showcasing knowledge and commitment to self-care. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.